The content of this podcast is for informational purposes only and should not be considered medical advice. Always consult with a qualified healthcare professional for any health concerns. Take care of yourself out there.
Welcome to Unravelling. This is a podcast that sees the world through the lens of mental health. I'm Mary Wilson, a journalist.
And I'm Kurt White, a social worker and psychotherapist.
And Kurt, as you know, this episode is releasing the day after what has been a very contentious election and has brought up so many emotions, a lot of stress for so many people. And we really don't want to talk about politics today, but we do want to talk about how they make us feel and why they bring up so much anxiety. Is this something that you're seeing in your work as well?
Yeah, among my clients, in myself, all over the place, I think. It's, it's definitely been on everyone's mind across the political spectrum. It feels like increasingly to me over a period of time, and very intensely so. And I'm sort of struck by how little sometimes we really know about that or have to say about that in the field of mental health. It feels almost like something definitely affecting us, but it also feels a little bit separate from our usual focus. Yeah,
there's a reason we try to avoid politics in conversation, right? And some of us turn off the TV when we see politics come on because we feel so anxious about it.
Yeah, and I think our usual frame as mental health professionals, we think about the internal world, and politics is so much about the external world. Of course, it's not really true, as we've often talked about, that like it's the intersection of these things is a really interesting area. So actually, we went looking today for somebody that has been studying exactly this kind of thing. How does the external, sometimes very often stressful world of politics and political beliefs and political events, how is this affecting our thoughts, feelings, opinions, and reactions to things?
Oh, this just sounds like the perfect topic for today. And no matter what side of the political spectrum you're on, you will relate to this conversation.
Yeah. Well, why don't we try to get into it then? Today we have Dr. Kevin Smith, who is a professor at the University of Nebraska-Lincoln, who studies the biology and psychology of individual level differences and political attitudes and behaviors. All these kinds of big questions about where do people get their beliefs and what's stressing us out and when do people change and when don't they? Looking at both the sort of physiology of our reactions to things like political events and stressors and situations, as well as our thoughts, feelings, emotions, and sort of triggers to feel particular ways about things, and even into what we can do about that.
All right, let's listen into that interview. Hi, it's Mary cutting in to let you know that we'd like to hear from you. We've had so many interesting discussions on this podcast and so many guests who we've spoken to. And now it's your turn to add your voice to the mix. We'd love to hear any questions or feedback, comments about the topics we've covered.
Or new topics, things that you see in your own lives about where does a mental health lens intersect with the world from your point of view? Are there things you'd like for us to tackle or talk about? Either in a big way or in a little bite-sized way on an upcoming episode. We hope that you'll give us a call, email us, send us a voice memo. We've got a phone number. That's 802-258-3763, 802-258-3763, or 258-3POD, or an email address, unravel@brattlebororetreat.org. We'll have those also in the show notes. Send us a voice memo, leave us a voice message, or just send us an old-fashioned email. We'd love to hear from you.
And now back to the episode.
Thank you, Dr. Smith, for joining us today on Unravelling.
I appreciate the invitation.
Can you tell me a little bit about your research and what you're up to?
Well, in terms of the research linking politics and health, we've been focused on this as a primary part of our research agenda for about the past 8 years. One of the things that I study is sort of like psychophysiology and how people respond to political stimuli. So basically, if we give you a political stimuli, does your fight or flight system go off? In very broad terms. And, especially as the 2016 presidential election got underway, one of the things that occurred to us is, we're seeing in the lab that people do respond to political stimuli in a way that is consistent with stress. And that sort of like raised the question, at least to us, of, well, maybe politics could actually be literally harming people's health. And there are, other studies out there by other research teams that have suggested that, politics can take a toll on mental health. It can take a toll on social relationships. And it can even have negative impacts on various aspects of physical health. Once we started to take a deep dive into it became clear to us that people hadn't really invested an awful lot of effort and time in trying to precisely measure and isolate the effect of politics specifically on health.
What do you mean by politics exactly?
Yeah, that's a good question. So basically what we're talking about is attention to politics and participation in politics. So attention can be something as simple as news alerts that come through your social media feeds. Participating in politics can mean voting, obviously, but also, putting up a yard sign, writing a check to a campaign, emailing a legislator. There's various things that we've looked at in terms of political participation.
And how is it that you're measuring stress? What are the ways that you're doing that?
So we've done this in a couple of ways. One of the things that we've looked at is cortisol levels. Cortisol is the stress hormone, and how levels of cortisol change when you go out to vote. And we found that if you go out to vote in person, your cortisol tends to go up in a different way from like just having a simple social interaction. That was an experimental study. And we've also measured it through a variety of surveys. And one thing that we've invested an awful lot of effort into is trying to come up with survey batteries that capture the scope of the impact of politics on psychological, social, and physical health. So we've been running those surveys off and on now since 2017.
And what have you found about the similarity or difference between the kind of stress or anxiety that maybe a persistent political stress might have to other kinds of anxiety, or maybe even people with anxiety problems, for example?
Yeah, and actually this is one of the things that we were really interested in, is people who express, high levels of anxiety or stress relative to politics. Is it really politics? Or are people who are suffering from high levels of anxiety and stress, politics is just, part of their broader environment that is driving those sort of like mental health issues. And so we've tried to address that as primarily statistically. There are good survey batteries out there that capture like generalized anxiety. And so one of the things that we've tried to do statistically is when we're predicting the effect of politics on, various aspects of health, we've done things like we've controlled for general levels of anxiety. We've controlled for emotional resilience. We've controlled for general personality traits like neuroticism. In other words, we're controlling for that in order to try and isolate, is it specifically politics, or is it politics just sort of like folded into those sorts of broader categories? And we published a couple of studies at this point which at least provide some empirical evidence that politics is a unique environmental stressor. And we think it's unique in the sense that it's absolutely unavoidable.
I've observed this myself, clinically. I think that's an interesting, and just in people I know, I guess I would say, that there are people who seem to be experiencing an intense level of stress and anxiety, and there are other people that experience it and then back away from it, actually sort of avoid it and try to stick their head in the sand and live in a cave. Have you noticed this sort of bifurcation or variance in this group also?
Absolutely. This is one of the things that we're interested in is why do some people suffer these effects and some people do not, or at least, suffer them to a greater extent than other people. One of the things that we've been looking at this year is agency or a sense of control. And one of the things that we found is that people who have relatively high levels of self-perceived agency, in other words, they feel in control of their own lives, they tend to suffer from these effects to a much lesser extent than people who don't feel like they're in control of what's going on in their own lives. And in politics, I mean, it's fairly easy to understand how some people could perceive that they're sort of like, at the mercy of the whims of the political environment. Oh my gosh, this person who I don't like and is going to do all these terrible things, and there's nothing I can do about it. Those sorts of people tend to be more likely to report higher levels of anxiety, not just anxiety and stress, but things like loss of sleep. They're more likely to report some sort of disruptions in their social relationships. They're more likely to say things like, I can't stop thinking about politics, even though I've tried to do it. I've said things on a social media feed that I've later regretted. So there's a whole range of things that this can lead to.
Is it your sense, and I understand we might not have enough sort of longitudinal time data on this to know it really, so it might involve some speculation about whether or not this phenomenon is sort of static over time, over history, or cyclic, or perhaps that there are factors that we might identify or speculate about that might be driving some levels of this particular kind of stress and anxiety?
Yeah, that's a really good question. And I think the only short, honest answer is we don't know. In terms of having data across time, where we've got sort of like these consistent batteries that are specifically designed to capture the impact of politics on these sorts of things, we've only really had them for 7 or 8 years. And over those 7 or 8 years, what the surveys across time tell us is, there's some electoral effect. It tends to get worse as elections approach. But generally speaking, these levels are fairly high and fairly steady. I mean, historically, you can certainly see that there are times in the nation's history when there's been a lot of polarization, and presumably people were really anxious and upset about what was going on. I mean, we had that whole Civil War thing. The 60s were a pretty turbulent time, a lot of violence, a lot of cultural upheaval. And so presumably there would have been, a lot of anxiety and stress around politics back during those eras. But we don't have comparable data. I think one of the things that makes this era different is the information environment. I think people forget how new it is to have sort of like this 24/7 constant information environment. I mean, we're all wandering around these days with mini supercomputers in our pockets that are pinging us with information. That's something that's only been around for 10 or 15 years.
Well, it strikes me. I mean, we're very used to it somehow, although it is a very, very new phenomenon. I mean, we can easily remember life without it, most of us, right? But at the same time, it feels very far away. And I feel like it has, for myself, it has changed the way that I have access to political news throughout the course of the day. I don't have to come looking for it. It comes to me. Things like that, right?
Yeah, and it's, even more than that, there are people using those information channels deliberately trying to get your attention about some aspect of politics. And the algorithms that sort of like determine what messages you're exposed to through things like social media are effectively designed to get your attention. And one way to get your attention is to, scare the crap out of you. Humans have a built-in negativity bias. We're more likely to pay attention to negative things than positive things, and algorithms will reflect that. I don't have any causal study to back this up, but one of the things that we've speculated about, that younger people tend to be feeling these effects more than older people. And it's younger people that have essentially grown up in this environment and are probably more exposed to it than older people. I mean, I get home and I drop my phone on the counter and then ignore it. I don't pick it up until the next morning. My kids certainly don't do that. And like with my undergraduates, I always joke with them when I walk into class is I see you're at your prayers, because they look like they're genuflecting before their phones whenever you walk in. One of the things that I think makes this era different is that communication channel, that direct connection to you, which is often customized. If you're active online, people track what you're doing, or the algorithms do, and try to feed you stuff that gets your attention. I mean, that certainly has its pros, but at least when it comes to politics and it affecting your mental health, it probably has its cons as well.
Well, I'm inferring a bit, but one thing that you studied, as I understand it, from what you said, is how much do people engage with it? Is there a relationship there with the level of stress and anxiety that comes up?
Yeah, absolutely. We have more evidence on political engagement. So, if you're a regular voter, if you're putting up yard signs, if you're watching the news, if you're paying attention on social media, there's a positive correlation between all of those things and reporting these effects.
And I'm trying to get a sense of the, intensity of the stress and anxiety that's caused by that, maybe compared to some other kinds of stressful life events, like a wedding or moving or something like that. You have a sense of maybe someone who's been significantly impacted by political stress or stress in the political sphere. How might their reaction to that compare to something like that?
Oh, that's a good question. I'm not exactly sure. I'm not sure that we've looked into that. I guess the closest I could get to that is we did one study. I proposed this almost as a joke. We took the PTSD diagnostic screening battery that is used by the Veterans Administration. So this is a set of questions that ask you sort of like, how often do you think of the event and those sorts of things. But what we did is we took those questions and we replaced the event with the election after the 2020 election. And we found approximately 13% of the people in our sample met the cutoff for, it's sort of like, hey, you might want to go get checked out. You're showing some symptoms of PTSD. Now, I want to be clear. We're not diagnosing people. We're not clinicians. You have to invest some faith in the validity of what we're doing, that's actually capturing some sort of like mental state akin to PTSD. And I can see that there might be a debate there, but I was astonished that we got that number. I mean, this is designed to be representative. It was a sample designed to be representative of all American adults, and 13% of American adults. That's a lot of people. I mean, that's tens of millions of people are basically meeting, the screening criteria for PTSD for an election. I mean,
that's very intense.
Yeah. The one other thing that I can say about that is we have repeatedly found that approximately 1 in 20 American adults agrees or strongly agrees with the statement, I have had suicidal thoughts because of politics.
Whoa.
And the first time we got that result, I did not believe it. I mean, I flat out did not believe it. I was like, this has to be some sort of sampling jitter. That just didn't ring true to me. But we've replicated it on two or three different surveys and got more or less the same results. So I'm starting to believe it. So that really shocked me.
So there's something very intense and important going on here, right at this intersection of our biology and the political sphere. I guess I can say as a clinician, what you're saying it's validating to me. I think other clinicians listening to this will feel comforted in a certain way, that the things that we've been noticing clinically are showing up across large samples and with rigorous research methods. At the same time, I think sometimes I think we feel it, clinicians feel it, there's a little bit of a lack in our field that psychiatry is so, like there's a kind of an assumption that things are kind of purely biologically driven almost. Stressors are out there, but they're in the background. They affect mental health problems. They don't really cause mental health problems. Maybe PTSD being the one really noted exception to that. But I think that's maybe not as true as we think it is in the mental health field. I think that there's something, I mean, that's why I'm sort of pointing to this kind of intersection here, that there's maybe something happening that is showing up in clinicians' offices, but isn't really sort of caused by the same kinds of things that we sometimes think mental health problems are caused by.
Yeah, because I mean, it really is sort of like thinking about the political environment in a slightly different way. And it also raises sort of like a huge question about, especially sort of like on the clinician side is what do you do about it? Because the one thing that I know of that, I'm pretty positive is like, what step can you take to ease stress and anxiety about politics? It's don't pay attention to it and don't get involved. Cause if you remove the cause, you remove the consequence. And that indeed might be good for people's mental health, but it's terrible for our civic health.
Well, that's very interesting to me too, because I think some of the people I know who are really miserable with this right at this moment, for example, are continuing to stay engaged because they feel it's essentially like a sacrifice worth making. And it strikes me that that's a kind of a perverse way to have to think about civic engagement.
Yeah, and there's a delicate balance here, right? Because there's quite a lot of research in political science that suggests having a negative emotional stimulus or feeling negative emotions around politics can actually be constructive because it can provide motivation to go out and get involved. It can help propel you down to the voting booth or put up a yard sign. And those sorts of things are generally considered good, constructive civic engagement. But, the sort of research that I'm doing does kind of suggest there's some sort of tipping point where this becomes pathological. And, I wish I had, a clear explanation of how all this happens and here's the tipping point and what you should do about it. But the bottom line is we just don't know.
Right. Yeah. The tipping point idea makes a lot of sense to me. I feel like, I sort of was, is there sort of a point of optimal frustration where our discomfort sort of engages us in a sphere where we're working toward a collective good with a manageable amount of stress, but it does sort of seem like with actually a lot of anxiety related disorders, that's actually what happens, right? Is that like anxiety is very productive up to the point where it's disorganizing. And this seems like it's kind of like that, except it's not really an anxiety disorder necessarily in the way we would normally think of it. It's a social phenomenon.
Yeah, there actually was a clinical psychologist, the name escapes me, around the 2016 election, actually coined the term election stress disorder. And that was based on what they were seeing in their practice. And there have been reports by other clinical psychologists and psychiatrists and counselors and therapists that patients are coming in and attributing their stress and anxiety specifically to politics. And this is anecdotal evidence, or at least it's anecdotal as far as I know, but it does strike me as persuasive. And it also suggests that there is something different going on right now, that people's identities, for whatever reason, are much more wrapped up in their partisan and ideological tribes than they were 20 or 30 years ago.
Yeah. I noticed that too. And also I think that it has the feeling that elections don't necessarily end these days, that they that you sort of move from one cycle into another one, and maybe even into the sort of, since maybe 2000, you move into the contesting phase, and then you move into the next cycle and the next cycle and next cycle. And I wonder if that's maybe a part of this, that it's feeling like not so much an episodic event that can be built up to and tolerated, but more of a continuous or chronic stressor.
Yeah, and that's one of the things that we definitely think is going on, is that it's a chronic stressor. It can, sort of like wax and wane. And, speaking from my vantage as sort of like a political scientist, I'm not sure that people fully grasp that in a representative democratic system, politics doesn't end. It's never supposed to end. An election is not an end. It's sort of like, the end of the first quarter in the game. The game is still going on. And even if you lose, you know what? 2 years from now, your team gets another shot at it. Politics is a process. It's not a game that someone ultimately wins.
I mean, maybe then as a sort of project to think about as a society would be how do we support the engagement with the democratic political process while also simultaneously trying to keep people away from this tipping point where it actually starts to have measurable negative effects on their health.
Yeah, one of the things that we're trying to do in our lab right now is get directly at that question, exposing people to political stimuli. And before we expose them to political stimuli, are there any sort of interventions that we can do that reduce the physiological response, stress response to a political stimuli? And we also give them a bunch of survey questions afterwards to see whether any intervention might have an effect on that.
Do you have any initial findings?
We don't really. Initially, what we were trying to do was a basic mindfulness exercise. And this seemed to be a no-brainer to me that, it's non-controversial to say that engaging in mindfulness exercises suppresses sympathetic fight or flight activity and increases sort of like parasympathetic nervous system activity, your rest and digest sort of system. Heart rate tends to go down, respiration goes down, those sorts of things. But at least thus far, we've only got some pilot data on this because bringing people into the lab and hooking them up to all the sensors and everything, that's, that can be kind of like an expensive thing to do. It didn't seem to work with politics.
Oh, that's really interesting.
Yeah. So nothing has been published or peer reviewed, and this is just pilot data. So you're talking about 80 undergraduates. So, take it with a grain of salt. One of the things that we did observe in that pilot data, though, is before we, had them do anything, we asked them whether they practiced meditation. And the people who practiced meditation, there didn't seem to be any effect on the physiological response, but on the self-reported, the perceived response was that it was having less of a negative effect on them. But the intervention itself, where we had them actually do a mindfulness exercise, didn't seem to be having much of an impact, which I was surprised at, frankly.
I wonder if it's because it's so tied up in aspects that are sort of core sense of self and identity. It maybe is too personal for something like a purely physiological kind of intervention, even a really good one to impact.
Yeah, that's absolutely right. And it could be other things. I mean, it's a small sample and it's not a representative sample. There could be a million things that it could be. But even given all of those sort of like caveats on our sample and whatnot, I must confess, I was expecting that to have more of an effect than we saw.
Well, I mean, it's mindfulness usually performs well. I mean, it's as close to a sort of nuclear option. It's so simple. It's available. You can teach it. It works for most things. It's better than we think. We can observe brain changes. I mean, it's sort of like the research is very, very robust. So I'm a bit surprised at that too.
Yeah, I 100% agree with you. My view of the literature when we were looking at this is that it's utterly non-controversial to say that mindfulness exercise can at least temporarily reduce feelings of anxiety and stress. And again, there's a million caveats on that. Ideally, what we'd like to do is get a more representative sample. A 5-minute mindfulness intervention in a lab, I mean, how much effect can that really have? I mean, ideally, what you want them to do is actually practice this for a while, randomly assign people into different groups and have some of them do it and some of them not for, a month or whatever before you actually, really hit them with a strong political stimulus.
I mean, even just the existence of something called the political physiology lab, I don't know, I never heard of such a thing. And it's sort of like the moment you hear the phrase, you think, oh my God, yeah, of course we need that, right? There's an intersection here.
Well, yeah, the bottom line is a lot of politics in terms of opinions, engagement, attention. Lots of people, or maybe most people, think of their political views and behaviors as being driven rationally. And what a lot of research suggests in political science and political psychology is primarily driven by emotion. And I mean, and I've seen this time and time again. We've had people in the lab who have very, very strong political opinions, and you don't have to probe them too far to understand they have no information, or they have very, very little information, but they are 100% convinced this is the right thing to do, or this is the right candidate to support. And I mean, emotions they have a physiological signal, and they're related to all sorts of things out in the real world, not just politics, right? I mean, emotions at base are an action predisposition. If you're angry or upset, I mean, that is something that will motivate you to relieve that emotional feeling. And that certainly seems to be the case in the political realm.
That's very interesting. What about the post-election period? What does the stress and anxiety profile look like in the sort of period following something like an election?
We actually did a pre-post panel study back in 2020, and the differences between post-election and pre-election were pretty minimal. I mean, it did go down a little bit, but not by much. The problem there was, and I mean, we had to place all sorts of caveats on that study, because pre-election was 2 weeks before the election and post-election was 2 weeks after the election. And that was an unusual election in that, the sitting president who had lost the election was refusing to concede, and there was a lot of uncertainty and turmoil in the political environment. So, if it had been a blowout win one way or the other, would we have seen different results? I mean, the bottom line is we just don't know.
So this episode will release on the day after Election Day. People listen to it the day it comes out. They'll be hearing it and will be probably tuning in or trying not to tune in to see what happened the morning after, what might still be happening. I know you're not a therapist, and we haven't necessarily figured out the answer to these questions. But I think it might be heartening for people even just to know that there are serious researchers trying to understand this phenomenon of anxiety and stress. What might you say to somebody listening who might be in this moment experiencing that kind of stress and distress?
I mean, I think one of the things that I'm on safe ground in saying is that, the United States political system has a set of institutions that are pretty robust and resilient, and they've been kicked pretty hard over the 250 years of the Republic. I mean, we've had a bloody civil war. We've had a major depression that sort of like economically devastated the country. We've had a period of, civil and cultural upheaval in the 1960s and 1970s, and the institutions have been robust and held. Now, have they wobbled a little bit in the past 10 years? Sure. But one of the things that people need to keep in mind, in 2016 and 2020, those institutions pretty much functioned exactly as they should have been. And what that is to say is, as long as those institutions hold, politics is not existential.
And, it strikes me that one thing that might be helpful for people is to try to connect with others. I think sometimes that's a missing factor. Do you agree with that at all?
Oh, I would 100% agree with that. In fact, I was talking to some clinical psychologists just over the weekend, and they had raised that very point. And my response to it was like, duh, that's obvious. Why have we not looked into that? And that's actually on the to-do list is, the density of social networks and social, connection. I mean, that's a hypothesis that I'm really interested in diving into, a little more, because it makes total sense to me that if you're in a, you're less lonely, you're feeling less isolated, you're probably in a better space and more resilient to, the sort of negative effects that might be coming from politics. I mean, I think the only caveat that I'd place on that is like, if you're in a a bubble, like a partisan or an ideological bubble, and your social network is basically reinforcing the notion that, oh my God, this is an existential threat to the republic. We're all going down. That's probably not healthy.
Right. Well, people tend to think that they're rational and the other guy's irrational, right? So
Yeah.
There's a little bit of can we find the middle way even when we're at loggerheads or something.
You're exactly right. I mean, one of the things that, when people find out, what I'm researching and, ask me for advice on this, I mean, one of the things that I ask is, find a couple of people that you like and trust who disagree with you politically and make a central point not to do anything that would damage that relationship because of politics. And your life will probably be richer, and you may feel, less anxiety and stress because some of the people who disagree with you politically. And in most cases, it turns out, they're pretty good human beings. I'm an academic, so, surprise, surprise, I hang around with a lot of people who are pretty progressive. But, I went to high school and college in rural West Texas. So I've got a lot of friends and a lot of family who are, as you might imagine, rural West Texas. I mean, they're pretty right-leaning people. And, both groups of people keep me grounded. And I'm not giving up my relationship with any of those people in any of those groups because of politics.
Well, thank you, Dr. Smith, for talking with us today. This has been really stimulating and informative and just enriching. I'm so happy to hear about your research. Thank you again.
Well, thanks very much for the invitation, Kurt. I've enjoyed chatting with you.
Thank you again to Dr. Smith for that really interesting discussion. And joining me here again is Mary Wilson. Mary, welcome back.
Yeah, thank you. Such an interesting conversation. And I know so many people are dealing with the dread and uncertainty right now. What sort of takeaways do you have after that conversation, Kurt?
Well, I think the thing that's landing for me is how persistent a stressor the political realm really is for many people, and how significant the impact of that can really be in people's lives. It was actually pretty interesting that some of the things that are well known to work to help sort of immediately reduce people's anxiety in moments of stress, like a brief mindfulness exercise or something like that, didn't seem to affect people's immediate stress and anxiety in this way. I mean, I think that says to me that this kind of tension and anxiety is a little bit different than a lot of other ordinary stressors. It feels a little more enduring, more persistent, more connected to our sense of self.
So there may have to be a different solution for overcoming this kind of stress and anxiety.
Yeah, and my best guess as a therapist is that will come from connection. That I think the worst kinds of suffering are those done in isolation, and our minds can start to feel very dysregulated when we feel like there's a situation that we're out of control of, and we're in it more or less alone, or with a group of people who are also similarly helpless in our ability to control our own fates.
And the bottom line, I guess, is we need to know that we'll be okay, right? No matter the outcome, but that can be tough in reality.
It can be. I think a lot of people are not feeling that way, right? But as one colleague said to me last week, he said, he's maybe a man in his 60s, a psychologist I know. He said, well, maybe this is the most stressful things have been in the political realm in his lifetime. He said maybe 1968 was close, but this is maybe harder than that. He said, but in the course of human history, not even close, right? Not even close. We've endured many, many difficult things. Why not this one? We have tremendous abilities as human beings to work out seemingly irreconcilable differences at the social level and find a way forward. We also have an ability to sort of fall into chaos and sort of destroy structures and civilizations and things that we've worked so hard to build. And I think it takes a kind of a collective effort to say we want to collectively move to the next step in our political world in a way that begins to feel, I think, more generative and less helpless.
Moving forward together. I feel like that's a little bit of optimism that we all need.
Yeah. I know that maybe people are probably feeling stressed right now, but I think we have to find a way to be okay together. We just have to.
It is helpful to hear that, Kurt. Well, thank you all for being along this complicated journey with us. And again, we thank Dr. Smith for his time and his expertise. If you'd like to learn more about the work that he does, you can go to his website or even find him on social media. And we have the links to those in our show notes.
Unravelling is brought to you by Brattleboro Retreat and is produced by Charts and Leisure.
Find us on social media by searching Brattleboro Retreat. Brattleboro Retreat is committed to exploring diverse perspectives on mental health. While we invite hosts and guests to share their insights, the views expressed are their own and do not necessarily reflect the policies or positions of the hospital or its staff.